This conference will now be recorded.
Hi, I'm Bob Fleckenstein, Life and Health Agent here at Desmond Insurance. Welcome to Medicare 101, The Basics. In today's session, we'll be covering the most commonly asked questions regarding Medicare. I'll be able to answer what is Medicare, who can get Medicare, how and when do I enroll in Medicare, do I need Medicare if I plan to work past the age of 65, what does Medicare cost, what does Medicare cover, and what are my coverage options? And last but not least, how do I enroll? So Original Medicare is made up of a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by taxes you paid while you were working, and it is individual health insurance. What Medicare is not, it's not free. It's not a family health plan. It's not Social Security, or it's not a state-funded program, Medicaid. Who is eligible? A couple things. U.S. citizens and legal residents. Legal residents must have lived in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. And you must also meet one of the other following requirements: age 65 or older, younger than 65 with a qualifying disability, any age with a diagnosis of end-stage renal disease or ALS, otherwise known as Lou Gehrig's disease. Original Medicare is made up of two parts. Part A is hospital, and that helps pay for hospital and inpatient care. And Part B is your medical. That helps pay for doctor and outpatient care. Part A, some of the costs that are included in coverage there are hospital meal and rooms, care and special units such as intensive care units, ICUs, prescriptions and drugs administered while inpatient, operating room and recovery room services, skilled nursing, some blood transfusions, as well as hospice. Part B covers doctor visits, which includes preventative visits such as flu shots, lab work including blood and urine tests, x-rays, MRIs, CT scans, EKGs, and some other diagnostic tests. It also includes physical therapy, occupational therapy, and speech-language pathology services, mental health care, durable medical equipment for use at home, like wheelchairs and walkers, and ambulatory surgery center services, ambulance, and emergency room services. Part A, what is the cost? So $0 for most people because they paid Medicare taxes long enough while working, generally at least 10 years or 40 quarters. This is sometimes called the premium-free Part A. If you don't qualify for premium-free Part A, you might be able to buy it. In 2024, the premium is either $285 or $518 each month, depending on how long or your spouse worked and paid Medicare taxes. And you also have to sign up for Part B to buy Part A. If you don't buy Part A when you're first eligible for Medicare, usually when you turn 65, you might pay a penalty. The deductible for Part A is $1,676 for each benefit period. These are 2025 numbers. Days 1 through 60, there's a zero co-insurance for each benefit period. Days 61 through 90, it's $419 co-insurance per day for each benefit period. Days 91 and beyond, $838 co-insurance for each lifetime reserve day after day 90 for each benefit period, up to 60 days over your lifetime. Beyond lifetime reserve days, all costs. Part B, typically the monthly premium is $185, and that is all based on income. That amount can change each year. You may pay a penalty if you don't sign up for Part B when you're first eligible for Medicare, usually when you turn 65. You'll pay an extra 10% for each year you could have signed up for Part B but didn't. Generally, you won't have to pay a penalty if you qualify for a special enrollment period. To qualify, you or your spouse must still be working, and you must have health care coverage based on that job. This chart here will actually give you a breakdown for Part B coverage and actual cost. As I mentioned before, for most people, it's going to be $185 a month for calendar year 2025. I would expect that to go up for calendar year 2026 when those new premiums are released. But you can also see here, based on whether you're filing adjusted gross income as an individual or joint, how the costs go up from there. Next, we'll continue to discuss costs for Part B. There is a $257 deductible. After your deductible is met, you typically pay 20% of Medicare approved amount for most doctor services, including most doctor services while you're in hospital inpatient, outpatient therapy, and durable medical equipment. It's often referred to as the 80/20 insurance. Items Medicare does not cover. It does not cover prescription drugs, routine dental, vision, and hearing, eyeglasses, contacts, or hearing aids, long-term care or custodial care, such as bathing, dressing, and home aid, care outside the U.S. except in limited circumstances. Coverage options. Part D is the prescription drugs, Part C is Medicare Advantage, and then there is Medicare supplements, otherwise known as Medigap plans. We'll go into each one of these. Option 1. What you want to do is after you enroll in Part A and Part B, you have the option to enroll in a Medicare Part D plan to cover your drugs. In addition to that, enroll in a Medicare supplement insurance Medigap plan offered by private insurance companies. And that does help pay for some, if not all, of the out-of-pocket costs not paid by original Medicare. Another option is option 2, where you enroll in Part A and Part B, but then you enroll into a Medicare Advantage Part C plan, which is also offered by private insurance companies. And Part C combines A and B together into one plan. It usually includes prescription drug coverage as well, so you would not have to register for a separate Part D plan. And it may also offer additional other benefits like vision and dental coverage. We'll go into each one of these. So original Medicare plus Part D, which again helps pay for prescription drugs. Medicare Part D insurance provides coverage for prescription drugs and some vaccines. Medicare D plans cover the types of drugs most commonly prescribed for Medicare beneficiaries is determined by federal standards. Specific brand name drugs and generic drugs included in the drug list formulary, and commercially available vaccines not covered by Part B. Formulary is a list of prescription drugs covered by plan, and they are based in tiers. So drugs are grouped into tiers based on cost. In general, the lower the tier, the lower the cost, and deductibles may be charged by tier. So typically, like tier 1 are going to be your very basic generic drugs, tier 2, preferred generic, and then so forth on up to tier 5, which are going to be your brand name drugs. New drug phases for 2025. 2025 deductibles for the standard drug plans is $590. Initial coverage phase, insured is going to pay up to 25% coinsurance for all covered prescriptions. However, the new annual out-of-pocket maximum is $2,000, and that was reduced from $6,000 from the prior year. New payment plan options are available through the carrier, and there is a catastrophic phase where a carrier manufacturer will pick up the remaining prescription costs once you reach that maximum of $2,000. Medicare premium payment plan. So beginning in 2025, Part D enrollees will have the option of spreading out the cost sharing payments over the course of the calendar year. This plan is open to everyone, but it will likely benefit those that have at least one prescription which costs over $600 a month. If an individual goes to the pharmacy and the total cost of the medication is $600 or more, this will notify the pharmacy that the individual is eligible for the M3P plan, and the pharmacy will provide notice of the plan and its availability. Medicare prescription payment plan. If an individual misses a payment on their M3P, They would not be terminated from their Part D plan. However, if they miss at least 2 consecutive months of payments, the carrier does have the right to terminate the Medicare premium payment plan. So it is important to ensure that you are making payments on time. If the individual switches the Medicare drug plan and has an MPP on record with that carrier, they will have to reapply with the new carrier, as these do not roll over from carrier to carrier. So if you do switch to a different drug provider and you had the MPPP plan with them, you will have to set it up new with the new carrier as well. So keep that in mind. And what will the application look like and how do you submit it? This will vary from carrier to carrier. Original Medicare plus Part D plus Medicare supplement. This is the option of adding the Medigap plan, which helps pay for some of the out-of-pocket cost not paid by original Medicare. Medicare supplement insurance is otherwise, again, known as Medigap, helps pay some of the out-of-pocket costs not paid by Medicare Parts A and B. It does work with original Medicare and Medicare Part D. Plans are offered by private insurance companies in your state. 10 plans standardized by federal and state law. Plans are labeled by letters. Like an example, there's a Plan A and Plan G. And what costs and services are covered vary by plan. Plans with the same letter offer the same basic benefits nationwide. Massachusetts, Minnesota, and Wisconsin standards plans are different. Plans may help pay Part A hospital co-insurance, the 1676 as previously discussed. It could also pay for Part A skilled nursing facility care co-insurance, Part B co-insurance or co-pays, cost of blood transfusions the first 3 pints, cost for 365 extra hospital days versus just the 60 lifetime reserve days, hospice care co-insurance, Part A deductible, which was the 1676, foreign travel emergency care up to the plan limits, provider charges above Medicare's approval amount. Plans do not help cover prescription drugs, routine dental, vision, or hearing care, but may have discount programs. They do not cover eyeglasses, contacts, or hearing aids. They do not cover custodial care, such as help bathing, eating, and dressing, or long-term care. Standardized Medicare supplement plans, as aforementioned, based on letter. So you can see Plan A, B, D, G, K, L, M, N, C, and F. And if you read down the list on the left, it will give you how much of each plan is covered for each of those benefits on the left side there. So just gives you an idea of the costs associated with each plan and the coverage. Medicare supplement insurance, Medigap, must be enrolled in both Medicare Part A and Part B and live in the state where the plan is offered. No medical underwriting up to 6 months after enrolling in Part B at age 65 or older. Nationwide coverage and no provider network. Guaranteed renewable as long as you pay your premium. So you pay your bills, you'll always be renewed. Plan premiums may vary for same coverage. Plans with more coverage generally have higher premiums, and most continue to pay Part B premium to Medicare. So if you choose the Medigap Medicare supplement, there will be a monthly premium. You'll still pay your Part B of $185 a month for 2025. If you pick a Part D, there will also be a premium associated with your Part D coverage. So just keep that in mind. Medicare supplement insurance. There is a birthday rule that is in effect for the state of Kentucky. That went into effect 1/1 of 2024. And what that states is you can change which supplement carrier you're with, but you have to stay within the same plan. So you can go G to G, N to N. Change may be made 30 days prior to your birthday and up to 60 days following your birthday. And this rule also applies to those under 65 as Medicare supplement beneficiaries. And the plan will be effective on the first of the month. Original Medicare plus Medicare Advantage is what we're going to discuss next. So Medicare Advantage, again, combines Part A hospital and Part B medical insurance into one plan. It usually includes prescription drug coverage, which is under Part D, and it may offer additional benefits like vision and dental coverage. So Part C, Medicare Advantage, another way to get your Medicare benefits, and it is an alternative to original Medicare, just like the Medicare supplements. Part C, Medicare Advantage, plan members are still in the Medicare program. Benefits are administered by the plan. Plans are offered by private insurance companies. Most plans offer built-in prescription drug coverage. Plans may also offer additional health benefits such as dental, vision, and fitness. All Medicare Advantage plans cover all benefits of Part A and all benefits of Part B. And in most Medicare Advantage plans, again, cover prescription drugs. Medicare Advantage plans may also offer additional benefits and features such as dental exams, cleanings, and x-rays, eye exams, eyeglasses, and contact lenses, hearing tests and hearing aids, as well as fitness program and memberships. So if those types of benefits are important to you, Medicare Advantage actually offers those, most of the Medicare Advantage plans. Medicare Advantage plan types. There's the coordinated care plan. So that's the health maintenance organization plans. A lot of employer plans have an HMO, so you may be used to that type of insurance. There's also preferred provider organization plans. There's the point of service plans, special needs plans, dual special needs plans, chronic special needs plans, institutional special needs plans, and institutional equivalent special needs plans. So there's quite a variety of different Medicare Advantage plans. Other plan types are private fee-for-service plans, as well as medical savings accounts. Part C, Medicare Advantage, must be enrolled in both Medicare Part A and B and live in the plan service area, very similar to Medigap plans. Can't be denied coverage based on current financial or health issues, including pre-existing conditions. May be required to use provider and pharmacy networks. Coverage and costs vary by plan and may change each year. Annual limit on out-of-pocket cost for covered services. They may charge a monthly plan premium, although most of them are zero premium. And they must continue to pay Part B premiums to Medicare. So whether you go with just original Medicare A and B, or you go with original Medicare plus a Medigap plan, or original Medicare and Medicare Advantage, you're still going to be paying the $185 for 2025 Part B premium. Cost of all these options, so comparing them. So you got the Medicare Advantage plans Part C, which we just went over. So you generally have low to zero monthly premiums. There are deductibles. There are co-pays, so it's kind of known as the pay-as-you-go insurance. There is co-insurance, and there is a out-of-pocket maximum. Part D, prescription drugs, you're going to pay a monthly premium. There is the deductible. There is also the copay and co-insurance. Just keep in mind the maximum out-of-pocket for Part D is $2,000, as stated for 2025. Medicare supplement insurance, you're going to have your monthly premium. That can vary, plan to plan, carrier to carrier. You're going to still continue to pay your deductible, and you're going to continue to pay co-pays as well. So with that said, the following steps, the process. First and foremost, you have to enroll in original Medicare, which would include Part A and Part B. From there, you either choose the option of a Medicare Medigap supplement plus prescription drug plan, or you choose option 2, which is a Medicare supplement, which often will include the Part D, as well as some of those other benefits such as dental, vision, fitness programs. Enrollment period. Your initial enrollment period is the 3 months prior to your 65th birthday and 3 months after your 65th birthday. So you always want to generally enroll early to avoid in coverage and late enrollment penalties, and you may refuse or delay enrollment of Part B with credible employer coverage. So a good resource to go to is www.ssa.gov, or you can call the Social Security office directly, or go to your local Social Security office to enroll. But if you continue to work, you may be eligible to delay. You may have to enroll at age 65. Generally, you can delay Medicare past age 65 without penalty if the employer has 20 or more employees and the employer's health care coverage is considered credible. You need to enroll at age 65 if your employer has fewer than 20 employees. Your coverage is not considered credible. And keep in mind, COBRA is not considered credible coverage. So oftentimes when you leave an employer, they'll offer COBRA coverage up to 18 months, sometimes beyond, depending on if you're the beneficiary. But just keep in mind that's not considered credible coverage. So COBRA is a federal law that may let you keep your employer group health care coverage for a limited time after employment ends. So to avoid gaps in coverage and Part B late enrollment penalty, you have COBRA before signing up for Medicare. Your COBRA will probably end when you enroll. You have 8 months to sign up for a Part B without penalty, whether or not you chose COBRA. And if you miss the period, you will have to wait until January 1st through March 31st of the following year to sign up, and your coverage will not start until July 1st. So you could have a gap created there. This happens, just something to keep in mind that it could also incur a lifetime penalty. HSA and Medicare. If you enroll in Medicare Part A and or Part B, and you no longer contribute pre-tax dollars to your HSA, you can no longer do that. After Part A and Part B begin, you may continue to withdraw money from your HSA to help pay for medical expenses. If you decide to delay enrollment in Part A and B and continue to contribute to your HSA, be aware of your timeline. You will want to stop contributing to your HSA at least 6 months before planning to enroll in Medicare. You do not, you will incur 6% tax penalty for all contributions to your HSA for the 6 months prior to enrolling in Medicare. So that's really important as you're planning to retire. If you have an HSA plan, you want to make sure you stop those contributions 6 months prior to enrolling in Medicare. Late enrollment penalties. Medicare Part A, none if qualified for premium free. The penalty is 10% of the Part A premium. Part B Medicare, none if you qualified for a special enrollment period and got enrolled in time. The penalty is 10% of the monthly Part B premium amount for each 12-month period enrollment is delayed. And then Part D, none again if that is 63 days without credible coverage. But the penalty is an additional 1% of the average Part D premium for each month you delayed enrollment. So with that said, that concludes my Medicare 101, the basics of Medicare and the process for enrolling. I hope you found this information educational and useful. And if you have any questions or you need assistance in helping choose the right plan, please give me a call at 859-491-5100. Email me at bob@desmondinsurance.com. I am licensed in Ohio and Kentucky, and I would be more than happy to help you. I appreciate your time and hope you have an enjoyable day. Thank you.